I think we're on now. Good. Marvellous. Well, welcome to our first public webinar. This will be just one of the ways we want to update people on our redevelopment plans. So we'll be listening each of these events and then making sure that we on everything that's fed back to us, incorporate that into our planning. These meetings will take place every month. And we're going to try and alternate between mornings and evenings, so we have the best possible opportunity to talk to as many people as possible. Just to start with, the redevelopment is a fantastic opportunity for us. As most people will be aware, the development of a new Hillingdon hospital has probably been talked about for more than we can all care to remember, and what we're doing at the moment is we are really taking forward our plans at pace, and that's very much what we want to go through today. We'll start with a short presentation, and then after that we will be taking questions. For those of you that are tech savvy, we have a chat box, so if you're all better people than me, but there's a chat box. If you type in there, we'll be logging all the questions and then we'll be going through them after the presentation. Just want to start with some introductions as well. So joining me today is we've got the team. So we've got Sarah Bellman, who is our communications lead on the redevelopment. We've got Abbas Kaku, who is our clinical lead for the redevelopment. Cassie from our programme management office, keeping us all organised, and Rachel Benton, who's our programme director. And I'm Jason Sees, the acting chief executive and the lead for the programme. So that's my initial ramblings. I'm going to hand it over to Rachel now, who will just take us through a short presentation. So hello, Rachel.
Thank you, Jason. So I'm just going to start by just saying a little bit about who we are. So we're a small to medium-sized district general hospital, serving predominantly the population of Hillingdon, but also parts of Ealing, Harrow, Buckinghamshire and Hertfordshire. About 80% of the patients that we see come from Hillingdon. We provide services from 2 hospital sites, so that's Hillingdon Hospital and Mount Vernon Hospital. And this redevelopment is focusing on Hillingdon Hospital, and that's the main acute site. So as many of you will know, it houses the accident and emergency and the critical care units. It's the main admitting site for emergencies and complex elective care. And it also houses the inpatient maternity and neonatal services and the inpatient children's services. Most of our outpatient services are also provided from Hillingdon. And I guess the final thing to say is the Trust is a significant employer with around 3,300 staff. And there are various stats around the edge of this slide. I'm not going to go through those, but it just gives you a feel for the sorts of activities that take place at the hospital. So why do we need to redevelop? So the current Hillingdon Hospital, as you'll know if you've used the hospital, and as some of these photographs indicate, is a very old building, and parts of the estate were built back as long ago as the 1930s as emergency wartime accommodation. And we know that 81% of the current hospital building is going to require major repair or replacement very soon. So if you've been to the hospital, you'll know that it's often not easy to find your way around. You know, we know from feedback from patients that the condition of buildings can make the experience of being in hospital more difficult. So we want to address that. So what are we proposing? So we've looked at a range of options in developing our strategic outline case, and our preferred way forward is to build a new hospital on the current site. So our current timeline would see construction start in July 2022 and complete late 2025. I think it's important just to stress that the hospital would remain open, so all services would continue to be provided during the construction, and I'll say a little bit more about that in a moment. I think it's also important to say that we're not planning to stop providing any services, so we plan to provide the same range of services as now, but they will be significantly modernised. So just building on that then, some of the benefits that we foresee from this new development. So clearly a much more attractive environment, so that benefits staff and patients, and we would hope would make a significant impact on the patient and staff experience. The buildings the hospital buildings would be fully compliant with the latest safety standards. We'd have much better connectivity between departments so that patients could sort of move more easily through the hospital. So the right things will be close together. We have significantly more side rooms, so that improves privacy, but also improves infection control. The new building would be much more efficient and therefore much more environmentally friendly. We plan to incorporate green spaces on the site, so obviously that benefits patients and staff, but also the wider community. We'd also have a lot more flexibility in the new building to adapt facilities. So, for example, if we need to respond to future pandemics, it gives us that flexibility. And we would build in sufficient capacity for the future to make sure that we can meet future needs. In addition to that, there will be space on site for potentially for other health and social care facilities, so that we could create a bit of a health and social care hub, and we are talking to partners about that. So all of this will, significantly improve our ability to recruit and retain a high calibre workforce, and that obviously brings further benefits for the quality of care provided. So where are we now in the process? So we've just completed the first stage, and that's the development of what's called a strategic outline case. So it's the first stage of the business case process, and that's been approved in principle by NHS regulators. So that's NHS England and NHS Improvement. So that happened at the start of October. So we're really pleased about that. Obviously, that's subject to further work at the next stage, and that's known as the outline business case stage, which is where we are now. So there's lots of things they've asked us to look very carefully at on making sure that we're getting the hospital right and getting the sizing right in relation to what's needed to meet future needs of the population, that we've got something that's affordable, that our procurement strategy delivers value for money, and that we're developing plans that make full use of modern methods of construction and reduce our carbon footprint. So on the 2nd of October, so the day after we went to the Joint Investment Committee, the Department of Health then renewed their commitment, so some of you may have seen that on the news, to supporting the building of 40 new hospitals, and Hillingdon was clearly named as one of those, so that's all good. So as I said, we're now developing our outline business case, and in that we're testing and further developing our preferred way forward for a new hospital build on the Hillingdon site, and we're well underway with our engagement and are very keen to listen to feedback and use that to shape our plans. So I just want to say a bit now about what's happening at the hospital right now to keep buildings safe. So that's the next slide, if we could move along. So I've already mentioned that there are significant maintenance needs across the hospital, and we know we need to make some improvements in the short term before the new build comes online. So we're putting up 2 modular buildings, so one in the north of the hospital, one in the south. So that will create temporary but high-spec additional wards, and that will enable us to move some services out of the current hospital. So these buildings allow us to deliver a programme of ward refurbishments and undertake essential work that we need to do to improve the environment for parts of the hospital where actually we can't wait. So that's essential for us to be able to continue to provide a safe environment for staff and patients ahead of the new hospital being built. So I hope that gives you some reassurance. Moving to the next slide, as I mentioned earlier, we will be keeping all services running on site during construction of the new hospital. So site enabling works will be undertaken in advance. So that will include decommissioning of old buildings and safe site clearance, and decanting some of the wards into the modular buildings that I just talked about will support that work. and that will ensure that once the main works commence, that the existing hospital is unaffected and can safely provide services to patients. Construction traffic will be managed to avoid congestion build-up in the local area, and we'll be using carefully engineered procedures to ensure that noise and vibration and dust is kept to a minimum during construction. So it's absolutely essential that we listen to the views of our staff, our patients, local residents, and all of our stakeholders to shape our plans. So to support that, we've launched our redevelopment website. There's also a monthly newsletter that has now started, and this monthly webinar series, and as Jason said, today is the first of those. So please do subscribe to our monthly newsletter on the website. Because of COVID, we're having to do a lot more online, but we know that not everyone can access online platforms. So we are looking at other ways to reach out across the community, and we will. So as plans develop, we will be seeking feedback on specific elements of the work, so that we can help to shape those plans. So this month, we've got an online survey, and that's seeking views on transport access to the hospital and car parking. We know from feedback that we've had so far that those things are very important to people. We're also going to be working with residents in close proximity to the hospital ahead of our planning application being submitted. So we'll be making contact with those residents in the next month to discuss plans and the way forward. So that's all from me. Thanks very much for listening, and do keep your questions coming in. I'm going to hand you back to Sarah now, who's going to coordinate our responses to those questions. Thank you.
Hi, thank you, Rachel and Jason. So we've had quite a few questions come in. So I'm going to start with one for Rachel from Chris about why was there no public consultation before the strategic outline case was submitted?
Okay, thank you. So, so formal public consultation is required if there's a proposal for a significant variation to services or to location. So we're planning to provide the same range of services, albeit delivered in a modernised way, and in broadly the same location. But ultimately, whether or not formal public consultation is required is a decision for commissioners and for the local authority. So we've had lots of conversations with them, and with the Hillingdon Overview and Scrutiny Committee, and so both commissioners and the local authority are satisfied that in this instance the requirement for public consultation hasn't been triggered. That said, we still very much have a duty to engage with the public to shape our plans, and we will be doing that. As I said previously, it's really important that we get as much feedback as possible, and that we are listening to those that we serve in developing these plans.
Thank you. I'm going to move to Tahir for a question now. So we've got a couple of questions, so I'll stay on you for a little while here, Tahir. But we've got one from Paul, first of all, about what parking provision, or will there be parking provision during the construction phase?
Thank you and good morning, and thank you, Paul, for the question. In terms of the new hospital, it is forecast to broadly generate a similar demand for car parking spaces whilst we are in the process of moving forward with the development and design of the new hospital. So our view has always been to maintain current capacity. Of course, naturally, as part of our wider sustainability and car parking strategy, we are looking to more innovative ways of addressing car parking to continue to be flexible enough to meet both the here and now and the future demands of the hospital. But in essence, broadly the same, and we'll continue business as usual in relation to car parking.
Thank you, Tahir. Another question for you, Tahir, from Valerie, which was wanting a little bit more detail about how will we be able to continue running the hospital on site while we're rebuilding, and when can the public expect to see more detailed plans about what the hospital will look like and where things will be?
Thank you again, Sarah. So in terms of the first part of that question, I think there's sort of two questions there. The first part of the question is how do we maintain continuity, I guess, the existing hospital and its facilities. We're quite fortunate that the proposed area of construction is already somewhat separate from the main hospital. It's largely made up of a series of very low-rise type buildings and majority car parking as well. However, we have and have started to develop more further, actually, a comprehensive enabling and decant strategy, which allows the hospital to continue operating as it is doing at the moment. So we are very confident that this will be continuing as normal without any major interruption. Of course, things do change and we will adapt to ensuring that any works are prior examined, reviewed, and undertaken in a way that does not affect the main operations of the hospital. The second part of the question, Sarah, if you could remind me again, the second part.
That was about when the public will get to see more detailed plans about where things will be.
Thank you. Well, as Rachel has already articulated, we've moved on to the next stage of the investment case, the business case. It is at this stage we're now getting into what would be known as the design development stage. We have already started an engagement process through Sarah, the communication team as well. So our plan is to bring on board at the appropriate time, once we have a level of maturity in the design itself, where meaningful information can be shared. So what I would say is keep a watchful eye on our website and the various bulletins that are going out there, and we'll hope to provide as much information as and when it's available.
Thank you, Tahir. I'm going to move on to Rachel. A question for you now, I believe. So I've got a question from Eamon around the funding for the hospital, whether it will be a PPI scheme and whether we can assure taxpayers that it will be a sustainable form of funding for the redevelopment. Rachel, you're on mute.
Sorry. Thank you. So no, it will not be a PPI scheme. We'll be seeking funding from the Treasury. So as you'll know, there's been an announcement around 40 new hospitals, as I mentioned, and you know, the government is putting aside a sum of money to support that. So that's what we'll be seeking to access. Public capital.
Lovely, thank you, Rachel. Abbas, I think this might be one for you. There's a question from Geraldine about in the work about what services will be in the hospital and the work that the clinical cabinet's doing. Are you looking at research and development within the hospital?
Yes, Geraldine, thank you very much for the question. So, whilst hospitals are predominantly for looking after patients, we recognise that there are a number of activities, for example, education, research and development, of course, facilities for staff that kind of underpin the work that the hospital does. And so there is a working group that's, as Tahir talked about, that's been put together to look at the functional output specifically related to things like education and art and research and development. So I will be making sure that in the next couple of weeks, the relevant team come and talk to the R&D team to make sure that there is adequate provision for services. I mean, if I can build on that, I think the new hospital is also an opportunity to do things differently, and actually we have to do things differently, and the new hospital is to enable those things to happen. So for research and development, it's also about using the digital. It's about using our partner, particularly Brunel and Imperial, and some of the facilities that they have. So we have a much more joined up approach to research. And of course, you know, the research and R&D team will be the subject matter experts. So, you know, we will be linking in with you to make sure that we take account of that. But be assured that it is in the plan for the new hospital. We just need to work out what it looks like and what the enabling bits of digital and networking to make sure it's fit for purpose for the next 20, 30 years.
Lovely, thank you, Abbas. Rachel, I think the next one probably for you. There's a couple of questions around why we didn't progress plans to, or ideas to build at Brunel.
Okay, so we did look in detail at the Brunel option, but ultimately the issue there is that it's greenbelt land, and therefore there's a complex planning process to go through, and it's highly unlikely that we would have been successful in securing planning permission, because there is a viable alternative, what we call brown site option, which is obviously the new build at Hillingdon. So it's unlikely to have, we were unlikely to have been successful with that option, and because of the complexity of planning, it would have taken another 3 years if we were successful to complete, and clearly there are some very pressing needs that need to be addressed sooner rather than later at the hospital. So that's the principal reason.
Thank you, Rachel. Abbas, I think actually Tahir, I've probably got quite a few for you now. So you're up on a few. I'll try and do them one by one. The first one's from Andrew, saying that the current hospital creates TV signal issues for some residents. So will that be considered in the design of the building?
Certainly we do. Yes, sorry, I thought I was on mute then for a moment. So certainly we do consider all digital interactions and interfaces with the hospital, and it'll be part of our design development to look at the impact through what we would do known as an environmental impact assessment. So one hopes that if there are issues that I'm not actually aware of that particular issue, but if there are such issues, we will certainly explore them and mitigate those.
Thank you, Tahir, and hopefully it's things like that will come out really nicely when we're talking with local residents, when we're doing our engagement. That's an example of why it's so important for us to be out talking to people in the roads surrounding the hospital, so we can pick up issues like this. Tahir, there's another question from Andrew. Will we be considering the provision of a helipad on the new hospital?
No, we won't be considering a helipad on the hospital.
Okay, nice and simple, thank you. And one from Debbie asking about, well, a couple of questions actually, asking about the environmental impact of the building and whether we'll be looking at making it as environmentally friendly as possible.
Absolutely, we will, as part of the planning process, we will, as I've just mentioned, look at a whole environmental impact assessment of this development and how it sits amongst the streetscape as well, and the impact on neighbours. But actually, as part of our sustainability drive, this is one of our objectives for this new build, is to build a net zero carbon hospital, way ahead of the government target for 2050. So indeed, we will be looking at any potential impact in relation to that sustainability agenda as well.
Thank you, Tahir. I'm going to stay with you, Tahir, and give you a couple more questions. So there's 2 questions here about what will be on the site. So will there be housing and accommodation for key workers, and will we be retaining the tower block?
Okay, so I'll do that in reverse then. So we will be retaining the tower block in the short term, and that will continue to offer healthcare services whilst we construct a new hospital. It won't be part of the new hospital construction. The second part is, will we be offering key worker housing? Well, this new hospital gives us the opportunity to work with our local authorities and other providers to see how key worker housing can be accommodated on what will then be the adjoining site to the hospital. So we certainly are putting this as a key consideration as part of our planning application.
Thank you, Tahir. I think the last one for you, Tahir, for now. I know you've talked about we've talked about car parking a couple of times, but as we know, it's an issue. There's a lot of questions and things around it. There is a question from Beulah around whether there will be more disabled parking in the new the redevelopment?
So, of course, we will be looking at the transport strategy, and we'll be looking at our car parking strategy overall. Absolutely, we would like to adhere to the exact ratios for disabled car parking to serve a hospital of this size and magnitude. What we're also doing is to take that a stage further as well, and look at where we can introduce electrical car parking ports as well, or chargers, so that we're encouraging people, not just disabled car users but others as well, to allow them to plug in their vehicles. So car parking is very much high on our agenda here, and it is something that we hope to provide sufficient services for.
Thank you. I'm going to jump to Abbas for a question now. Abbas, there's a question about how will the new hospital collaborate with Brunel with the new Brunel Medical School in terms of training clinicians?
Okay, so short answer is that the hospital will collaborate with Brunel for medical students. Medical students are going through a difficult time at the moment, are the Imperial medical students, because of course of the COVID restrictions, but they're slowly getting back on site to see patients in a safe way. And hopefully by the time that Brunel students arrive, which will be, they'll start their clinical work in September 2023, which will of course be whilst we still have the old hospital, or the current hospital. We will be accommodating them, and they are involved in part of the planning that Tahir referred to about the functional outputs, in terms of making sure that we have adequate provision for the number of students that we take. And it's part, if I'm being honest, it's part of our ongoing close collaboration with Brunel that isn't just about the medical school, it's about the physicians associates, the physiotherapists, the psychologists, the business school, some of the training initiatives, some of the research and development initiatives. So actually the new hospital will help us strengthen those partnerships.
Lovely, thank you, Abbas. Now we're sort of coming towards the end of the session now, so I'm just going to move on to a last question, which I'll put to Tahir. So these questions are, well, there's two parts to this question, but it's about whether the modular buildings are already in use and whether we've started enabling works on the site.
So yes, the modular units. So we have two sets of modular units, commonly known as Modular North and Modular South. Modular North is partly in the commissioning stages, but a third of it is currently occupied as well. That has signified the start of our enabling and decant strategy, which will help move out from some of our most dilapidated ward accommodation. The plan is to have Modular North fully occupied before the end of this year. Modular South will indeed come on stream, with installation being completed by the end of March 2021. And again, that is associated with assisting with the enabling and decant strategy. Just to add, we have also commenced site services enabling works as well. So we've started to look at the main infrastructure to see how services could be appropriately diverted ahead of the new hospital coming on stream.
Lovely, thank you, Tahir. Jason, over to you.
Thank you very much, Sarah. So just just to recap, apologies, didn't introduce Tahir at the beginning. That was Tahir Ahmed, our Director of Estates and Facilities, who, thank you very much, has answered a number of questions today. So just in summing up, thank you to everybody who's joined us today. I hope you found that helpful. In ensuring that we sort of really take on board everybody's views and we're sort of planning the new hospital together, we're obviously going to continue with these meetings. Let us know feedback about how this one went. If there's any way you think we can improve it, let us know. And we look forward to the next one and continuing this process, really. So some really, really good questions. Thank you.